Happy New Year. Thank you for joining us live. I'm Kara Jacobson, your CoolSculpting host. We're here in sunny Beverly Hills, California with world-renowned facial plastic surgeon, Dr. Paul Nassif. Probably recognize him from his hit TV show. Thank you for having us today.
It's great to see you.
Thank you. So to all of you who are joining us live, we hope that you're excited. You're going to have the opportunity to see both a male and a female patient having a CoolSculpting treatment performed today at Dr. Nassif's practice. Dr. Nassif is going to be with us to answer all of your pressing questions. So please don't forget to leave your comments and questions below because we'll be able to answer them as we go along throughout the day. We're going to cover things like how much does it cost, what to expect, does it hurt, who's a good CoolSculpting candidate, does insurance even cover this procedure, and so much more. But before we do that, Dr. Nassif, we'd like to know just a little bit more about you.
I'm a facial plastic surgeon in Beverly Hills. I've been in practice for about a good 19 years. I'm only 28 years old though. And I'm known pretty much for fixing a lot of bad boo-boos of the face. And we have a beautiful office in Spawn, Beverly Hills.
It is lovely.
And we brought CoolSculpting in quite a while ago because we had so many people say, listen, I don't want to have liposuction. And I got these stubborn areas. I try to diet. You know, I just can't get rid of these little flanks. I can't get rid of this. I can't get rid of that. And so we started thinking about CoolSculpting quite a while ago. Did all my research. And now that's why you're here, because we love CoolSculpting.
Perfect. So you've got a notable background. You have the opportunity to do both liposuction or choose a non-invasive procedure. So how do you pick the right patient for CoolSculpting?
Expectations are very important. So you have to come in for an assessment. So for example, you would come into my office, Colette, our lovely physician's assistant, would assess you because it's very important to be assessed. You're not going to just walk into an office and have the procedure, or I should say that's not the right way to do that. You come in for an assessment to make sure the right candidate, in other words, it's not a substitution for weight loss. Or if you have a lot of extra areas that need to be taken care of, it doesn't work that way. This is for someone who lives a healthy lifestyle, someone who actually already works on how they eat, exercises, and have a few stubborn areas. So you have to be assessed, and you also have to be realistic.
Absolutely. Expectations are incredibly important. So you've got the right patient in the front door, but what about those patients who are leaning on the fence? They're not exactly sure that CoolSculpting even works. So what do you think about the science, the technology behind CoolSculpting?
So cryolipolysis, which means freezing fat cells. So we're all born with a certain amount of fat cells. Now, as we gain weight, those fat cells get larger. As we lose weight, the fat cells get smaller, but they don't go away. But what's actually happening here, as you apply the applicator on the area, and it gets a certain cold temperature, it's freezing those fat cells. Basically, the fat cells die, they go away, and then your body naturally flushes them out. Now, that's a non-invasive way to do this. It takes about 35 minutes. It's a little cold, but it's not really that much discomfort. And you might have, after the procedure, a little bit of numbness, a little bit of tingling, a little bit of a bruise, which all goes away. It's temporary. When you freeze these fat cells, they're naturally eliminated. So that means the fat cells are gone completely. Now, you're not going to come out like a brand new person, because every time you do this, it is going to prove it. You can do this. We recommend you have it and come and have it once. And if it is done properly and you are the right patient, you should get about a 20-25% reduction in that area that's FDA cleared.
Dr. Nassif, we have a lot of people who are live with us today who are interested in CoolSculpting. What makes a good CoolSculpting candidate? Can you be male, female? What does the right patient look like for you?
Okay, so the right can be male or female, and also someone who doesn't want to go into an invasive procedure like liposuction and the healing and the risks associated with that. But again, someone who's in good health, who has some troublesome areas, stubborn areas of fat they can't get rid of, someone who's already eats well, someone who exercises routinely and takes care of themselves. So for example, if I didn't believe in this science, I wouldn't subject my nephew Ryan, Mr. Stud over there, to have CoolSculpting. Now he's going to get it today done on his flanks because he's had these areas. Now we work out together a lot, And even though he's in a lot better shape than I am, plus a lot younger, but he can't get rid of these areas. And these are stubborn areas. So he, for example, for a male is a great candidate.
So Ryan, your uncle here has thrown you to the wolves. He's brought you in for your first CoolSculpting treatment live on Facebook with us today. Tell me a little bit about why you're interested in having CoolSculpting performed in the first place.
Well, he pretty much summed it up. We work out together a lot. I eat healthy, do a lot of cardio, we lift weights, and for 2018, really wanted to get rid of these flanks that I haven't been able to for a couple of years. So
it's interesting too. Is you've mentioned that to me probably for the last 3 or 4 years.
Yeah.
I love it. We're going to make your New Year's resolution come true.
Absolutely.
Awesome. Well, I'd like to turn it over to the audience. If you're interested in seeing this non-invasive fat reduction procedure, go ahead and put a little snowflake emoji in your feed. Perfect. Here we go. I see some coming. All right, people are getting excited. They're ready to see your nephew on the CoolSculpting device. But first, we have to go through and see what an assessment looks like. I know people are dying to know what's the process when you come into a practice.
Okay, so basically we're going to do a run through with Ryan and we're going to look at this area together. So usually I stand behind the patient and I have them look in the mirror and we kind of look and see, Ryan, this is the area that's bothering you, right? So if we took this area in like this, how would that make you feel?
Wow, that's impressive, Colette. You're really whittling away his waist there.
It looks like I might have to do this eventually myself.
Ryan has an amazing physique, as we have already addressed, and I think he's a great candidate for CoolSculpting because he does have this one area that's stubborn fat. So a lot of our fat cells have been placed in these areas since we've been a young kid. So even though we go on these crazy diets and rigorous exercise routines, we can't tend to lose those areas as much without doing CoolSculpting, because CoolSculpting helps to remove some of those fat cells, not just shrink them down. Put your hands up in genie style like this. Perfect. So we're going to look and see where the peaks of the fat are, which are the fat bulges. And we want that to be in where the center of this template is.
Perfect. So you're drawing a long straight line, it looks like, where his fatty tissue starts, and a line where it ends.
So are you bisecting it?
Beautiful.
That fat? So the fat's on both sides of that.
Yes.
This is a really good visual. So Colette's actually going to use the CoolSculpting template. So we're going to be able to see the whole treatment area.
Well, that's a pretty big size too.
Thanks.
No, I mean the template. The template is big. Now, does that marker come off?
So this is the one area.
That looks beautiful. Colette, so what's actually being treated? Can you pinch and show us what area we can expect to be cooled?
This particular stencil actually replicates the exact piece that's being treated. So everything inside this green region here is going to be treated. The area that's the actual peak, the bulge of the fat, is going to be placed in the center, and the fat will be bifurcated right in the middle in this area.
All right.
When we evaluate this, we usually look for treatment to transformation, what their optimal end result is. So when we remove this fat and we remove the same fat on this area, it will be slightly different the way that we place these pieces.
That's really interesting. So that's an incredibly important part of the assessment process. What you're saying is, Ryan, you're a little asymmetrical, and that's very normal for most people. And due to her evaluation, you may need more than one treatment on one side. And treatment to transformation means what? What is that exactly?
So basically, treatment to transformation means that we are looking to see what the full end result would be for that particular person's area. So if they want to have where there's absolutely no fat in that area, it's more cut out, then that would be the end of their transformation. Some people, like you had said earlier, just want to look better in clothing, so they're happy with just a little bit of reduction. So now we're going to actually cleanse this area.
Beautiful. So Colette, you've got it marked up, you cleansed his tissue. Dr. Nassif, our viewers at home want to know, what does CoolSculpting feel like? What can the patient expect?
Once the applicator gets put on, it's going to actually suck up the skin into it. And then what happens, once it turns a little cold, then you'll get used to it pretty quick. You're going to feel, for the first couple minutes, you're going to feel, going, that's getting a little cold. All of a sudden, you get used to it.
Okay.
Usually what we do is we have two machines. We'll do both sides simultaneously. But for today, For the demonstration, we're going to just do one side at a time, correct, Colette?
Yes.
All right.
That's amazing. So in your office, you have 2 machines in the same place, so you can do twice as many treatments in half the time.
Half the time, exactly.
Perfect.
All right, let's get them going.
No, you're gonna stand up for one
Standing,
side.
okay.
So Colette, what are you going to put on Ryan right now? What's happening?
Right now, we're gonna put on the protective pad that's gonna protect his skin from the actual cooling.
Beautiful. What does the pad feel like?
Does it feel? How's that feel?
Feels sticky.
Does it feel sticky?
Yeah.
Does it feel cold?
No, it feels warm.
Does it hurt?
No.
Perfect.
All right,
Go
so here
for
we
it.
go for the moment that we're waiting for. We're gonna turn this vacuum on
Perfect.
and suction the fat into the device. Ready, Ryan?
Yeah.
1, 2, and 3. Voila.
How does that
How's
feel?
that feel?
Feels fine. I was expecting a little more of a suction, a little more aggressive of a suction,
Yeah.
but it's not. It's very comfortable, and it's fine. Feels
So a
good.
comfortable, gentle suction, tolerable. You're still standing.
Yeah.
You look good.
So I haven't fainted or anything.
Perfect.
It's fine.
I think we're a little bit better set up here. All right,
Just sit back more.
sit back.
You're doing a great job, Ryan. How does it feel?
It feels fine.
It's a little awkward getting into the treatment bed.
Yeah, it's a little awkward.
But does it hurt?
No, it
All
doesn't
right,
hurt at all.
we're good. Go ahead, have a sit back.
Is it-
I think that.
So what are you doing right now, Colette? You're
So we started the device and the cooling is going to begin. Do you feel anything?
Yeah, it's getting colder.
And no pain though, right?
No, no pain. Zero pain.
So now that we've got Ryan set up, we actually have another treatment that's occurring in the other room. So we'd like to bring you guys into the next room to see what the end of the treatment looks like. Sound good, Dr.
Let's do
Nassif?
it.
Let's do it. So we have Alla here. Hello, Alla.
Hello,
You're having your abdomen treated?
I am.
Beautiful. So tell me a little bit about your treatment. What are you excited about? Why are you getting your abdomen treated today?
I am very excited to get rid of some of the stubborn fat that I have.
Mhm.
I'm excited to kickstart my New Year's resolution.
Here we go.
Very nice. Dr. Nassif, you're helping her achieve her New Year's resolution goals.
I love hearing that. How does that feel?
It's just a little cold and tight, some suction, that's about it.
Very nice. I want to turn this one over to the viewers. Dr. Nassif, do you think we should find out what other people would like to have treated?
That's a great idea. Love to.
So in your comments below, why don't you let us know what areas you want to have treated with CoolSculpting? So Dr. Nassif, we're getting some feeds in. We've got upper arms. We've got abdomen. Why is she having her abdomen treated? Can you tell us a little bit about this treatment plan and what she can expect?
So Ella has basically, she's in good shape, watches her diet, but again, that little bit of fat in this one in the lower abdomen, she can't really get rid of. Now, she doesn't want liposuction.
Perfect.
That's a surgical procedure, time off of work, everything else. So with this, the applicator is put on for 35 minutes, and she obviously is feeling a little bit of the cold feeling.
It's
And over a
cold.
period of 90 days, she'll start to see a progression of 20 to 25%. That's the way it's supposed to work, of a reduction in the size of the abdomen.
So Alla's achieving her New Year's resolution goals. You're saying she's a good candidate because she maintains her lifestyle the way that it is,
And she's realistic, by the way.
and she's realistic. What does that mean? What's a realistic patient look
I mean,
like?
listen, those numbers I gave you, 20, 25% of that, this is a generalized number, but it works better sometimes for some people than others. So it's like any surgical procedure. It's really how your body responds to this procedure. So I cannot tell you exactly what your result's going to be. And again, this is not a specific mechanical science. It's not like me doing a facelift where I'm tightening up and removing exactly a certain amount of skin. So this is something that pretty much we have to actually see how you heal. But the satisfaction rate, if you are assessed properly and you're realistic, you, the patient, you should be very happy.
Dr. Nassif, I want to know, talk to me about a couple things. The treatment plan. You're saying that you can't guarantee what the results are going to be like because we need to know how your body responds. Tell us what a complete treatment plan looks like. And then also, can we hear a little bit about the technology? What does it look like when the fat's leaving your body?
Everyone's body is different. By the way, a lot of abdominal fat sometimes is not just in between your skin and the muscle. It's called visceral fat. Visceral fat is deep around the organs, and that causes some volume, especially in men.
Kind of that big, hard
that big, hard, the big, hard pot belly. Now, so, by the way, this is for men and women. And a lot of men come in here, just like women, about equal almost, and they'll sometimes come in with this big pot belly and go, no, you need to lose weight.
So wait a minute. In order to lose visceral fat, you have to have a diet and exercise plan?
Absolutely.
Then what does CoolSculpting treat?
CoolSculpting is for the subcutaneous fat. And again, you still have to eat well and exercise. It's for the stubborn areas. So it's not a substitute for weight loss.
If you want to know if you have subcutaneous fat that can be treated with CoolSculpting, you can pinch your area of treatment in the mirror.
You sure can.
So if you can pinch the tissue and pull it away from the body, it's likely that you might be a good CoolSculpting candidate.
Absolutely. Now the technology, this is cryolipolysis, basically freezing the fat cells. Now when you freeze the fat cells, it dies. It's gone. It's dead. Doesn't regenerate. And then your body naturally circulates them through your body, and then you remove them.
So the cold kills your fat cells. It's processed through your lymphatic system, and then that's it? They're gone for good?
That's it.
Amazing.
They're excreted away.
What happens after the treatment? What's the protocol? What can a patient expect? What do they have to do afterwards to maintain their results?
After the treatment, you can go back to your normal activity.
Ala can leave this treatment bed and go to yoga after she's done.
She sure can.
She can walk her dog.
Yeah.
She can pick up
As
her
a matter of fact, I want them to do some activities.
Oh, okay.
I want to get that lymphatic flow going. I want to get everything moving around.
Okay.
And even though this is a slower process, you're not going to immediately start excreting fat cells that quick, but you will start some. But again, it's over a long period of time that this happens. I want her normal activity, and I want her doing, she should be fine. So we have, what, about another minute, Colette?
Yes. Another minute. What happens after a minute? Ala, are you excited?
Yeah, I am excited.
Are you nervous? What can you expect?
Nope, I'm just ready to see what's going on under here.
I mean, you're not going to see it all of a sudden decrease in size, and that's where expectations come in. Remember, this takes 90 days. So you can't look at it the next day and go, my God, what happened? And call the doctor's office. Remember, that's what the communication between someone like Colette and you, the patient, whether you're a young lady or a young man here, have to have that discussion on what to expect. Expectations, just like surgery, are very important. You have to discuss it and know what to expect.
So are expectations during the treatment and after the treatment the same for both men and women?
I got to tell you, men and women usually ask different questions. But the expectations at the end, we kind of make them walk out with the same expectation. That was it, huh?
That signals that our treatment is over, and we're going to remove the piece.
Perfect. So if we can zoom in, it looks like she's removing the applicator right now. Dr. Nassif, her very own Vanna, working hard right now.
Look at that.
Beautiful.
It's a little bit red.
Dr. Nassif, why is it red?
Okay, that's red from the applicator, which is more from the vacuum. That vacuum sucking up the skin, and a little bit of the chilling. And that will be gone shortly. And then now what's going to happen is Colette's going to massage it.
Does the massage
it actually feels, by the way, it feels firm. Right after you do that area, it feels very firm.
Oh, so the tissue
feels
cold.
firm.
Can I feel it?
Sure.
Let me see here. Yes, guys at home, it is cold.
Feel it, Ola.
Yeah, it feels like a little ice block right there.
Yeah.
Amazing.
And if you want later on too, when you're at home, if you feel it feels better, you want to massage a little bit, you're more than welcome to.
Why are we doing the massage right now?
Because right now it's going to feel, you're breaking up the tissue, since it is cold, the subcutaneous tissue and the fat has pretty much gnawed up a little bit because it's been frozen, and now we're kind of breaking that up. So we're starting the breakdown process of the fat.
Perfect. And Colette, can we expect to see an improvement in this area because of the massage?
Yeah, the massage is actually the most important part of this procedure. We see about 65% improvement with our treatment because of the massage.
Awesome. Ala,
Yes.
is it comfortable? Tell us the truth.
I can tolerate it. I just feel like I'm defrosting.
You're defrosting.
Yeah.
So now that we know what the actual treatment looks like, we've seen the entire process, I think we should answer some questions from the emails that were submitted.
Let's do it.
Are you ready? They're challenging.
All right, let's see if we can do it.
So the first question is from Adam. I think I'm actually going to field this one. Adam wants to know, how much does a CoolSculpting treatment cost? Now, correct me if I'm wrong, Dr. Nassif, but it's really dependent upon your personalized assessment. Every body is different. So we'd love for you to come into a practice, have a complete CoolSculpting treatment to transformation assessment where they can tell you exactly how much it's going to cost. That being said, we find that on average, treatments cost between $2,000 and $4,000. Does that sound fair?
Absolutely.
2 minutes are up.
2 minutes are up.
2 minutes, I like
All
that
right. What other questions do we have? Let's see what else we have. Okay, so Gabe wants to know, Dr. Nassif, can men be treated in the same areas as women?
Absolutely. I mean, but the areas are going to be a little bit different, but in general, let me reiterate the FDA cleared areas. Here, especially men come in and love that area.
Oh,
The
because they
submental
can't
area.
hide their double chin, right?
Bra fat, I don't know how many guys will come in for that. Upper arms, maybe not that many for men,
What
but
about
they can.
flanks?
Flanks, yes. Abdomen, yes. Thighs, inner, outer, distal, probably not. Now, most men don't do that. Banana rolls, I haven't seen a man ask for that yet. But remember, for men, abdomen, flanks, here are the most common areas.
Are the most popular areas. That's absolutely true. But both men and women can be treated in all of the FDA cleared areas that Dr. Nassif just stated. Oh, we have one more. Hold on. Nikki wants to know, who is an ideal candidate for CoolSculpting? Dying to know your answer.
An ideal candidate is someone who actually is already fit, exercises, has a good lifestyle, is on a decent diet, but has those stubborn little areas of fat in one of the FDA cleared areas that I spoke about. Just can't get rid of it despite the workout. And that is a great Oh, also realistic. Expectations are very important. So we have to have a patient who basically has the problem that will fit with CoolSculpting, but also is realistic.
Absolutely. Do you think it's fair to say that when patients come in for their personalized consultation, you can determine not only if they're a good candidate, but that they have realistic expectations?
An astute clinician can do that. So if you come in here and you say, you know what, I want to go from a size 12 to a size 6, it's not happening. I want to lose 40 pounds, it's not happening.
Do you lose weight with CoolSculpting?
No.
Not a pound.
I do not see, I don't know of anyone who've actually lost weight.
Yeah, it's true. So basically you just lose
The size.
the size. Interesting. Let's see what else we have. Dr. Nassif, they want to know, is CoolSculpting covered by insurance?
No. I mean, this is an elective cosmetic procedure. I don't know of any insurance companies that would take care of this.
Do we have any other questions from the audience coming in? Any comments? Oh, this is a great question. So we've actually had many people who've commented below, and they want to know, if you have a medical condition, can you have CoolSculpting performed?
Well, the assessment's very important. That's why you have to come in for that assessment and give a great medical history, especially, if you have heart disease, high blood pressure, you still should be able to actually do this. However, if you have some serious medical conditions, I would recommend that you ask your primary doctor and say, I want to have some freezing fat in this area. I'm going to be sitting there for 35 minutes. Can I do it? And in general, most patients that we have can do this. There hasn't been many patients that we've turned away.
Perfect. So Dr. Nassif's time is very important. We want to thank you so much for giving us a window to your practice, everyone.
Well, thank you, Kara.
Thank you.
Pleasure meeting you.
I appreciate it.
Thank you.
I'm glad. Just keep us updated with your progress.
Will do.
Dr. Nassif, before you go, one thing. If you want to leave the audience at home with one takeaway, if they remember nothing else from your broadcast, what do you want them to know about CoolSculpting?
If you have a stubborn area of fat that just doesn't go away with dieting and exercise, and it's an area that we do, that's FDA cleared, come visit us.
Well, thank you, Dr. Nassif, for your time. Ladies, thank you so much. Alla, we're excited for your treatment.
Thank you.
So there you have it, you guys. CoolSculpting is a safe and efficacious treatment that can help you achieve your New Year's resolution. We want to thank everyone who's joined us live today. We hope that you had as much fun as we did. Did you have a good time?
I did.
You survived?
I hope you all enjoyed this.
Perfect. Now go jumpstart your New Year's resolution and find a place to have your first CoolSculpting treatment today. Thank you very much, everyone. Stay cool.